Today, the World Health Organization has really identified the lack of human resources as one of the most critical issues that we face globally in trying to deal with the global burden of disease. So it was out of that context that the School of Nursing developed a global health certificate.
Global Health Certificate program is 12 credits in total. The major courses are the global social justice, critical issues in global health, program planning, and a capstone, which is a class seminar, and then a capstone field experience. That is the field work.
HBN Nigeria has this apartment that hosts all who come to do work in Nigeria. It is safe, it is very accommodative. You have your room that is pretty much safe content, your bathroom in there, a small refrigerator, TV, your internet, so you don't really have to, disturb anybody trying to say, oh, I want to access my email or whatever. You have everything self-content. The culture, they have Muslims, Christians, a variety of tribes, traditional rulers, government dignitaries, you have everything. And respect and hierarchy is part of the day. That was the one thing that I really appreciated so much in Nigeria. There was so much respect. People meet you and they greet you, the men greet and they go and welcome.
Our project was research focused and also had a programmatic component to it. The goal was to examine exposure to blood-borne pathogens among Nigerian healthcare workers. From the survey results, we wanted to provide feedback to the nurses we worked with to create awareness about their sharps exposure and knowledge of universal precautions. The participants were nurses and midwives, and we distributed the survey to 2 federally funded hospitals and 1 state-funded hospital.
So our goal was to collect information to identify and improve our understanding of the healthcare workers' perceptions of task shifting and its effect on working conditions. So the study involved 4 focus groups. We did 2 focus groups with nurses and 2 focus groups of physicians. In my personal reflections about the nursing practice and the nurses there in Nigeria is that the nurses there are very dedicated and committed to the work they do there.
What we call nursing board over there, they call it nursing council. So we went over there to discuss how we can do faculty exchange program, how we can go over there and teach and we can exchange. We have to have their faculty come to the University of Maryland.
The findings that the students came up with are not just something that is going to be presented in abstracts, but really they had the time and the opportunity to dig into some of the programs that are going on, like this task shifting program, or how effective and long-lasting the trainings are having to do with universal precautions. So these are things that people didn't know there. They didn't realize particularly some of the systemic problems in getting task shifting implemented. So already the preliminary results have been fed back to IHB Nigeria, and they're redesigning their training programs, in part in response to the work that you have done.